It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Grace Sells. Welcome back to another edition of the Best Docs Network, featuring, of course, Grace, some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
Now, up first on the show, we're going to hear how bariatric surgeon from Bariatric Solutions, Dr. Scott Stowers, is able to be more accessible to his patients with a mobile unit for follow-ups.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors, and with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site, or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working, and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band, and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
I never intended to have a facelift. However, I had married a gal for several years, and during those time I gave her lots of plastic surgeries. And then I found out that she had, after she left, she actually got remarried, and a fellow showed me her picture on Facebook, and she looked, at 55, she looked absolutely wonderful. Just really good. And I thought to myself, you know, if I could pay the money for the plastic surgeries for her, I bet you I have enough money to pay for it for myself.
John is a very intelligent gentleman who was close to 70 years of age, and he wanted facial rejuvenation surgery, but he wanted a very natural look. He didn't really want to necessarily look that much younger. He wanted to look rested, and he wanted to look good, and that's what he was after, which was very realistic for a gentleman who's close to 70 years of age.
It is unfortunate that more men do not choose to get a facelift because it makes a tremendous difference in their appearance. They get their chin back, they get all the wrinkles taken out of their face, and they look younger, and obviously they're going to have more respect when they're younger.
There's many actors and other prominent figures in our community where the males have had facelifts and they look like they've had a facelift. They have almost an unnatural look. In a gentleman, you have to be extremely careful because if you make him unnatural, you tend to feminize him. And I think the last thing a male wants is feminization of the face. They just want rejuvenation of the face. So I believe that we were able to achieve all that, yet giving him a very natural look to the point that he doesn't look like he's had facial rejuvenation surgery.
The surgery has given me a confidence to put myself on some of the dating services, the .coms, and the results have been excellent. I've probably had a different date at least once a week, maybe sometimes twice a week. And the number of people responding to me, I realized that they were younger and younger and younger. And typically the people that respond to me are aged somewhere between 50 and 55. And that's not bad for somebody 68. I'm very, very pleased with that.
Taking a break with a change of scenery or change of pace is good for your mental health. Simply take a 5-minute break from your household chores or a 30-minute lunch break during your workday, and those small breaks are enough to de-stress you with a fresh mind.
Having a beautiful smile can significantly boost your self-esteem. Let's take a look how cosmetic dentist Dr. Guy Lewis was able to help Sandy smile more with a painless smile makeover.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Coming up next, we'll learn about the importance of having a set bedtime and how it can help you get better rest.
Plus, see how one doctor can give you a facelift without going under the knife. All this and more when we return.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Best Stocks Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Aging is a multidimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen and elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
Did you know that establishing a bedtime ritual helps your body know when it is time to sleep? You can establish a bedtime ritual by doing the same things, such as brushing your teeth, reading a book, or listening to soothing music every night an hour or two before bedtime to relax your mind.
How do you know if you have a stomach ulcer? A lot of people have heartburn, but what's the difference between simple heartburn and a stomach ulcer? First of all, stomach ulcers are very serious. These are little erosions or scooped out areas in the stomach where the acid is eaten a hole. These can bleed and cause lots of problems. You'll know they're bleeding if you have black bowel movements. That generally is the color of blood as it runs through your intestines, and the acid changes it to a black color. But how do you know if you have an ulcer instead of just heartburn? Here's how. First of all, when you're hungry, you'll get a little gnawing pain at the pit of your stomach, just up at the top of your stomach. Once you eat, then the food in there absorbs the acid, and then you quit hurting. And then about 2 hours later, when the food gets out of your stomach, the acid's still there a little bit to help digest, then you'll get pain again. So you get discomfort when you're hungry, you eat, it gets better, and then it gets a little worse a couple hours later. That's usually an ulcer. Now, there are blood tests for ulcers and even breath tests for ulcers, and there is great treatment. So check it out if you have those kinds of symptoms, but don't worry about just plain heartburn. Just eat less pizza or whatever makes your heart burn.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
For more information about any of our outstanding doctors you see on today's show, the good news is, Grace, You can head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
That's right, Jim. Now up next, we're going to hear from plastic surgeon Dr. Robert Wilcox and how he was able to help Victoria regain her figure after having 2 children.
I had 2 children in the last 4 years, which is wonderful. I wanted to, get back to my normal shape, and I, started looking into getting lipo and things like that, and so I found Dr. Wilcox.
Well, liposuction is still one of the most popular cosmetic procedures done nationwide, as well as in our own practice. My preferred technique is ultrasonic liposuction, and that has proven the test of time. It's been present for about almost 15 years. Rather than just literally ripping the fat out, the cannula or wand is made of titanium. It's about this length. It has a hollow bore down the middle for suction. The tip of it vibrates over 20,000 times a second, and that's how it gets its name, ultrasound. And so we can just go back and forth gently until we can get about 2/3 of the thickness of the fat removed.
So I came in, told Dr. Wilcox that I would like to slim down around the hips, look at some areas of the stomach where the fat wasn't coming off. So he explained to me, he showed me what all he could do and what the result would look like. I was pleased with what his expectations were.
First of all, during the consultation, I make clear to them the best thing about coming to our practice is they're going to get the straight story. There are many patients every week who come in where I explain, I don't think the surgery's for you. We may be able to offer a non-operative measure, or maybe they just need the encouragement to realize they don't have the problem that they perceive in the mirror. In Victoria's case, she came in requesting the breast enhancement and liposuction, so we looked at her and looked at the common areas that are usually done. And she has a nice figure, and she was close to her ideal weight, but she had enough fat on her hips and abdomen that we could help her with that and make a significant difference.
I'm extremely happy with the results. They've exceeded my expectations as well as my husband's expectations. It is a quick recovery for such a big result that you get. It's just very exhilarating because I just have me back.
Still to come, we'll learn how eating your meals at the same time every day helps to promote a healthy digestive system.
Plus, see how one woman was able to receive exceptional skincare from Dr. Yadro Ducic. All this when we return.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy. Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Welcome to the Best Docs Network. In the studio, we're very pleased to be joined today by one of the top LASIK surgeons, not only in the Dallas-Fort Worth area, but in the country, Dr. Harvey Carter. Dr. Carter, thanks for being with us today.
Thanks for having me.
It's a pleasure. And now talk to us about how you started in this field.
I chose this field of medicine because I loved microsurgery, and I found that out very early in medical school. And ophthalmology is an incredible mix of microsurgery, laser surgery, and wonderful, wonderful technology.
And you did your undergrad at SMU. Did you always plan to come back to Dallas to start your practice?
Yes, that was my goal. I came to SMU because of the pre-med program back in the time that we went here, and then went to LSU Medical School in New Orleans. Then did my internship back here in Dallas and residency in Georgia, and then back here to Dallas again. So I love Dallas.
That's great. And you have a lot of ties to the community, very involved in the Dallas community. You're the official LASIK eye surgeon of the Dallas Cowboys. That has to be both exciting and very rewarding.
That's been an incredible journey, and I sort of fell into that.
Really?
Went to a charity event many years ago. And while we were there were a number of Dallas Cowboy players there. And one thing led to another. And first, Tony Casillas' wife came in and had LASIK surgery. And then Tony Casillas came in and had LASIK surgery. And then I think it's like 50 or 60 Cowboys over time came in and had LASIK surgery.
That's so fun. And what would you say sets your practice, Carter Eye Center, apart from other eye practices in the Dallas-Fort Worth area?
I really think it's personal service and high technology. Patients, I think, are looking for personal service, and at the same time, I think they're looking for high technology. They want the latest, greatest, they want the best.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
So before I met Dr. Ducic, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Ducic does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look, and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
For more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Now it's time to introduce you to our next best doctor. That is pain management specialist, Dr. Jason Williams, who tells us how he treats those suffering from painful bulging and herniated disc.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting. And that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Acuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%. BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Sarah has a question for Dr. Michael L. Thornton. What is a Brazilian butt lift?
A Brazilian butt lift is basically a two-in-one procedure. It's a procedure where you're performing a lot of liposuction to contour the waistline, okay? And once you take all that fat out during the liposuction procedure, then you put it back in the patient's butt. So it's called a Brazilian butt lift. And what it does is it gives them a nice waist to hip ratio, okay? You want to get a small waist with a nice round bottom. And you put the fat back inside their butt. Instead of throwing away the fat, you're actually harvesting the fat to put it back into their butt and sculpt it so it looks really nice. And there's a few tricks. It's a very artistic procedure. It's not something for everybody. You have to know what you're doing so you can make it look good, because not everybody can make a butt look good.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And for more information on any of these outstanding doctors, even request an appointment, you can head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story of your own, we love hearing from you. Just send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We will see you next week.